Hackensack Meridian Children's Health is comprised of 2 nationally ranked children's hospitals by U.S. News & World Report and are number 1 in New Jersey. K. Hovnanian Children's Hospital in Neptune and Joseph M. Sansone Children's Hospital in Hackensack, as well as pediatric inpatient and outpatient services at JFK University Medical Center in Edison. With access to expert pediatricians and over 200 pediatric specialists across the state, Hackensack Meridian Children's Health prides itself on offering specialized pediatric medical care and surgical expertise. To learn more about Hackensack Meridian Children's Health, visit hackensackmeridianhealth.org/kids. Welcome back, everyone, to the Mom with Moms podcast. We are rolling through the first quarter of the year. It has been this is the fastest winter of my life, I think. I don't know if it's just because I'm very busy, but there's a lot going on. I'm planning 2 pretty massive events at the moment and working on, we actually just moved into our office in Red Bank, so a lot of fun things happening, and I think that's probably has something to do with why the time has been flying, but I can't believe that it's spring break. My daughter is actually, I just found out last night that, like, you know, when like you have like a certain break coming up or with your kids or whatever, and then it's just like all of a sudden that it's there and you didn't realize that they're off like 2 days prior. Mm-hmm. That was me last night. I was like, oh, you're off on Thursday. Oh, okay. All right, awesome. Figure that one out. So all the things, juggling all the things, but that's what we do, and that's why we are here for you. So we are continuing our family healthcare series today with Hackensack Meridian Children's Health, but switching it up a little bit. Being that March is International Women's Month, Women's History Month, we wanted to focus a bit more on mom health, right? And with that, I think a big topic that has come up more, recently with our focus on women's health is pelvic floor health. So we thought it would be really great to have Dr. Stephanie Sansone today on the podcast from Hackensack Meridian Health to discuss a lot of things that I think moms don't even really understand that they have, but to really, answer questions and find out that like there are actual solutions, right, to things that maybe you're just walking around uncomfortable with. So, Dr. Stephanie Sansone, welcome. You are a fellowship-trained obstetrician-gynecologist specializing in urogynecology and reconstructive pelvic surgery. She is passionate about delivering evidence-based practices in all aspects of treatment for pelvic floor disorders, beyond conservative management and in-office procedures for conditions such as pelvic organ prolapse, urinary incontinence, and overactive bladder. She's experienced in robotic, abdominal, and vaginal reconstructive surgery. Welcome.
Great. Thank you so much for having me, Kate, and nice to meet everyone on Mom with Moms.
Yeah. So we were just chatting a little bit about this now. I've seen like a more prevalent, different resources that are coming up about pelvic floor health. I'll be honest, maybe 3 years ago, I didn't even know what the heck a pelvic floor was. I didn't know I had one. And I didn't know that it needed any, fixing.
Yes.
And there's a lot of, talk about, postpartum and kind of, your new body, incontinence, pain, after pain during sex after having a child, and really just kind of, adjusting to your new body because your body is it prepartum, I guess, right?
Before having a baby.
Then, is much different. And it's, it's getting used to your new body. And also, not just even specifically postpartum, but perhaps you have a 10-year-old or a 20-year-old and like me, and didn't really realize that maybe you had some issues that you just kind of been walking around uncomfortable.
Yeah.
So let's start with why a mom or a woman would come see you and what different, different symptoms they would have for things to arise.
Absolutely. And I think you really hit the nail on the head that a lot of people did not know that urogynecology was a field or taking care of the pelvic floor. So just to briefly define what a urogynecologist is, it is an OBGYN or urologist that has gone through extra training to care for these conditions. And we really take care of the pelvic floor muscles, which is located at the bottom of your core, so really the foundation. And those muscles control how we urinate, how we defecate, and the support structures to the uterus, bladder, and the rectum. So prolapse, for example, that's when those tissues can weaken and you might feel bulge or weakness in that area. And like you said, 10 years after childbirth, you might say, something just doesn't quite feel as right as it did once before, and is this normal, and should I seek care? And while urogynecologists were used to seeing patients 50s, 60s, 70s with greater awareness of our field, we're seeing patients much younger come to us in their 30s and 40s.
So one note that I when I was speaking to a pelvic floor specialist a few months ago, is something about like how you stand and how, like, I guess sometimes like you don't realize that you are maybe favoring one area because you're just like in pain. So what does that look like? Or is it because like you're in pain? Is there something that like needs to be adjusted? Like why would your alignment, I guess, need to be adjusted?
Yeah, so I think, like you said, because we are upright creatures and now we're used to sitting a lot, right, with kind of how we work now, you can find yourself sort of favoring to one side, especially after pregnancy or delivery. Those ligaments or connective tissue might be weakened, so you might find yourself favoring that weak side to kind of lean on it. So definitely step one is, like you said, aligning if you feel as though you're crunched at work. But the other thing, too, that people don't realize is when we carry a lot of strength in our neck, we can also be carrying, a lot of stress in our neck. We can also be carrying a lot of stress in the pelvic floor. So if you find yourself almost contracting your pelvic floor muscles when you're sitting, it's going to make it a lot harder to urinate, go to the bathroom like you normally do. So really taking note of your awareness of the pelvic floor and relaxing when you're in a seated position so that you don't find yourself favoring, and just really aligning the back and keeping the pelvic floor relaxed and a seated position, I think, is something a lot of us tend to clench all the time, and we really want to stay relaxed.
Interesting. So does the severity of, I guess, some type of, is there damage done to your pelvic floor because of childbirth, or how does that work exactly?
Yes, we know that women who have a vaginal delivery compared to a C-section that was scheduled, or sort of an unlabored C-section, we say, are at a higher risk of developing a pelvic floor disorder, whether that's leakage of urine with cough, laugh, sneeze, or feeling bulge or prolapse like we talked about. And that risk is higher in women with a vaginal delivery who have had, a significant tear or episiotomy or an operative vaginal delivery.
So can you go into childbirth like knowing certain things about what can happen to prevent it? Is it preventable, or?
Definitely. So I would say a lot of questions we get asked is, should I have a C-section just to prevent, all of these things from happening to me? And we do not. The American College of Obstetrics and Gynecology does not recommend that. Because a C-section is major abdominal surgery,
right,
and the recovery after a vaginal delivery is much easier. But going in, we know that just having awareness of overactive bladder or urgency of urination, frequency of urination, and leakage that goes along with childbirth, women just knowing that, awareness of them in the postpartum period can actually decrease psychological stress, postpartum depression, and other things, like you said, in the postpartum period. Why am I leaking? Just sort of knowing this is normal. A lot of women experience this after childbirth can really help with some of, the psychological trauma associated with childbirth.
Interesting. So how do you know that you have any pelvic damage? Maybe like you have a little bit of incontinence, or maybe you don't. Like, will you be in pain?
Not necessarily in pain. It's more, I would say, when you're noticing you have to wear a pad for leakage of urine, if you're sort of, running around, you're tracing your kids and you're noticing, like, when you're on the trampoline with them, when you're jumping up and down or lifting them, that you might have little splashes or drops, and you're like, oh, that's a new experience. There's definitely things to do to treat that, ranging from just working on pelvic floor exercises to minor treatments and surgery down the line.
Okay. What kind of surgery is it?
Yeah, so there's, for the leakage of urine, specifically with activity, there's procedures that help sort of build support back to the pelvic floor, to the urethra or the tube that you pee from. So one is actually very minor. It's called a bulking procedure. So just like people put gel filler in their lips these days, you can also put it in the urethra to help close and give more support. It can be done in the office.
Yeah.
It's a bulking agent is what it's called.
Okay.
But that's something very minor that I would say when I'm looking at the demographic of moms, 30s, 40s, very common, because the other one is a sling procedure, which we would not recommend doing until you're done having children. It's more robust recovery, so we recommend like no heavy lifting for a few weeks afterwards. So there's some downtime associated with a larger surgery, but the bulking procedure, no downtime.
Got it. Okay. Other than incontinence, what are some other symptoms that you will experience if you have some issues with your pelvic floor?
Yeah, so I would say overactive bladder symptoms. So needing to go to the bathroom more frequently. So that's defined loosely as more than 7 times a day. Waking up at night to go to the bathroom, or having to go urgently, such that when you're trying to get to the bathroom, you may also leak because you don't make it in time.
Oh.
This can develop also during pregnancy. Just also the feeling of pressure on the bladder.
Yeah.
It's really funny. I was talking to my friends who are all pregnant, and they always ask me their questions about pregnancy and the pelvic floor. A lot of women get into the habit of almost like pushing and bearing down to urinate when they're pregnant, because they feel like the pressure, like they have to get it out.
Yeah.
You really should try not, as best you can. Don't push to pee. I know that's like it's a funny little tagline I would tell my friends just in passing, because you really, like I said, relaxation of the pelvic floor is how the bladder then just contracts and empties. So you shouldn't feel like you have to kind of push out any urine.
Interesting.
Yeah.
Huh.
Yeah.
What are some other reasons a mom would come see a urogynecologist?
Yeah. So going back to the postpartum period, another large reason for distress can be sort of a tear that a mom has. So tears after vaginal delivery can range on a scale of 1 to 4. 2 is the most common, or a second degree. 3 and 4 is much more rare. Only about 2 to 3% of women undergo a 3rd or 4th degree laceration. But those are the women that are more at risk for having poor healing, potentially, having issues with loss of stool, loss of gas. Very embarrassing thing to talk about, for sure. But those women can benefit from getting into pelvic floor physical therapy early, or if there's a need for any type of revision, that would be someone that you can come see me to have an evaluation for that. That's something, across the country, these postpartum pelvic floor clinics for women who've sustained these traumatic deliveries, especially with a vacuum or forceps delivery, offering that specialized care here, I think is fantastic to offer that.
Let's talk a little bit too about pain during intercourse. I know
Yeah.
that's kind of a big one, and probably something that doesn't come up too often because
Yes.
it's uncomfortable to really express, or maybe a mom is just kind of like, ugh, like it's the last thing on earth that
Yes.
I am going to, seek help for,
Yes.
right? When there's
Yeah.
a laundry list of other things that need to be taken care of.
Exactly.
For their children and for their
Right,
families.
right.
But what is that is that related to childbirth, and how does that work?
Definitely can be. So there's 2 things to bring up. One is the hormonal changes associated with pregnancy and after delivery, especially in breastfeeding moms. So in moms who are breastfeeding, because the brain and your hormones are so focused on producing prolactin, or the hormone to help lactate, there's actually less estrogen sort of being sent throughout the rest of the body, because the body's keeping those breasts going with prolactin. So that can lead to significant dryness in the vagina, actually.
Okay.
So one thing that a lot of women can seek out is vaginal estrogen replacement for breastfeeding moms. Any breastfeeding mom that I see with, issues with intercourse, that's the first thing I recommend, because it restores estrogen back to that area, and it does not get absorbed into the body. A lot of women get freaked out about taking hormones.
Yeah.
Yes, but vaginal estrogen is absolutely safe. We even give it to patients with a history of breast cancer, assuming everything is going well, and typically with the discussion with their oncologist. So vaginal estrogen in response to hormonal changes associated with breastfeeding is one thing for sure. But especially, like you said, if there was a significant tear or scar tissue, things may have not just healed correctly, or the vaginal canal may just feel different.
Yeah.
So if you find that, your pelvic floor is more tense, there can be helpful with pelvic floor physical therapy to help relax, so that with intercourse you're able to, not have, this tense feeling. So that's definitely super helpful as well. And obviously always using lubricant the first time after childbirth is super helpful. Little things that you may not have needed to do beforehand, but are just extra steps to think about now.
So surgery wouldn't be necessary usually in this case?
Not necessarily, unless there was like a laceration that wasn't healing well.
I see.
You wouldn't necessarily. The reasons to think about surgery after childbirth would be for prolapse, but that typically patients don't have symptomatic bothersome symptoms of prolapse typically for several years after delivery. Of course, always exceptions, but typically it's something that develops down the line.
Interesting. I want to touch too on how I think the perception may have been to see someone for your pelvic floor or to see a doctor for hormones and stuff in your maybe late 50s, 60s, 70s, but that's not the case, and that you may require to see a doctor for some of the symptoms that you're having younger or earlier.
Yep.
But also why would someone older, a woman older, see a urogynecologist in their 50s and 60s?
So going back to hormone conversation, once women enter menopause with lack of systemic estrogen and estrogen to the vaginal area, there is more likely to have things like recurrent urinary tract infections, given lack of estrogen in that area, as well as that's when most of my prolapse patients I tend to see around in their 50s, 60s, 70s, because with other risk factors beyond just childbirth, things like chronic constipation, where you're straining to get out bowel movements, weight gain, chronic lifting, that's with all those added sheared forces to the pelvic floor, you're more likely to see hernia of the vagina or prolapse. So,
you can have the hernia there.
Yeah.
Wow.
Yeah, exactly.
Huh.
So that's kind of
that.
where the real like reconstruction comes from, is when it's sort of you feel this bulge that's kind of coming down.
Wow.
Yeah.
Huh. I didn't know that.
Yeah.
Can we talk a little bit about hormones and what is
Absolutely.
prescribed? I think I know that there was a time that, because you mentioned women get a little freaked out from hormones because I guess there was a study done that was linked to breast cancer, right?
Yes.
Yeah.
Yes.
But now there's been a lot more advancements in hormones, and I only know this from this great series.
Yeah.
I've learned so much from so many different doctors that have come on to talk about that hormones can be very beneficial to adding to for this specific in menopause and perimenopause as well.
Yeah, definitely. I agree. Hormones are definitely safe to take, and while there is an increased risk for things like breast cancer and stroke, blood clot, these risks are low. So if you're really suffering from things like vasomotor symptoms, so like hot flashes, mood swings, definitely safe to take under the care of a gynecologist. We always say to start at the lowest dose for the shortest amount possible. So when you're put on hormones, it's not, I'm going to be on my hormones forever. So I think that's kind of a misconception that a lot of patients have. But you really should reevaluate each time you see your GYN. Do I still need to be on the hormones, or should I take like a little bit of a break? Because as we age, being on hormones for long term is not recommended.
Can they change your mood?
Yeah.
But I guess in a good way?
In a good way.
But not in a bad way.
Not in a bad way. Typically not. Typically hormones are beneficial to your mood. And there's new drugs coming out. I don't prescribe them, but even for patients with low libido that are coming out, because that's another thing that people don't talk about. As women age, they tend to lose interest in sexual relations. And so there's a lot of research being done in that area as well.
And that's mostly hormonal. It changes. That can also happen postpartum as well.
Definitely.
Yeah.
Definitely.
Interesting.
Yep. And that's all within, the normal realm. So really partner communication is key, and making sure that you're ready to return to intercourse, based on your schedule as well. I know schedules are crazy as a mom, but definitely something to talk to a urogyn or your GYN about.
Interesting. Okay. We talked a little bit about preventative means. You mentioned, to not push when you pee. And
Yes.
and certain things that moms can keep in mind going into childbirth.
Yeah.
But what are some things that perhaps they can do knowing, maybe if they had a friend who went through that experience, just to minimize any type of issues postpartum?
Definitely. I think it's definitely reasonable to do pelvic floor exercises leading up to delivery. And what do I mean by that? So pelvic floor physical therapy is an amazing resource, especially in our area. There's a lot of pelvic floor physical therapists, typically with long wait lists. But what this means is you would work with a PT who's done extra training in the pelvic floor. You'd work with them once a week. Typically, it can be covered. Some of them are covered by insurance in a private area, and they would work on strengthening the pelvic floor through not just Kegels, but also possibly implementing something called biofeedback. So that would mean, inserting a device into the vagina while you're doing a Kegel, and you can watch on a screen as you squeeze to make sure you're actually doing the exercise right and the relaxation. Yeah. And they're coming out with all these at-home devices with biofeedback ability to really make sure you know how to do these dedicated pelvic floor exercises. Yeah. And I'm sure, I know you're active on Instagram and social, but there's a lot of physical therapists that have videos on Instagram and YouTube. I do want to plug that. A lot of them actually are excellent. So if it's really done by a doctor of physical therapy with specialized pelvic floor training, definitely something to pause and watch. The reason I say that is because there truly is a lack of pelvic floor physical therapists in the area, and the people that go into it are so passionate that when they the content is actually awesome. And in our urogynecology academic journal, they actually studied it and found that popularity and reliability had a significant positive correlation. So weak positive correlation, but there was, between being popular online and being reliable based on our metrics, the correlation was there. So I tell my patients all the time, if you see a physical therapist you vibe with on social, definitely follow along.
Oh, wow. That's so interesting.
Yeah.
Yeah, I know a few. And I think through just, working with so many local resources, but you're right. They are passionate and very like dedicated to helping women, which is incredible.
Yeah.
So definitely exercises postpartum. Anything like hormonal that to keep in mind? Is that within your?
Yeah. So I would say, again, after delivery, normal to experience sort of those overactive bladder leakage symptoms. That is normal for up to, it can be like 6 to 12 weeks of recovery.
Okay.
And, I've been called to the postpartum wing sometime for consults for patients who, have had a tough delivery. And on top of all of that, they can't hold their bladder. And I tell them, I'm going to see you in 2 weeks, and then another 2 weeks, another 2 weeks. And each time you see me, it's going to get better. And it does. But I will say, once you hit, I would say almost like the 12-week mark, if you are having leakage or, bothersome symptoms of like a pelvic floor hernia like we talked about, it's reasonable to pursue additional treatment beyond. And to your point about hormones, yes, again, it's really about lack of estrogen in that period. That can kind of just lead to tissue weakening and, also just the passage of a baby through the birth canal, the stretching of the nerves in that area just leads to loss of sensation to the bladder and the rectum as well. So all within normal, but typically give it a good 12 weeks. And if you're still having some of these issues, reasons to come see me.
So you're experiencing some of these symptoms postpartum or even years later, and you bring it up to your gynecologist, I guess. That would be the first step.
Or you can self-refer to Urogyn.
Oh, you can?
Yeah, you can.
All right. So you can just call and make an appointment. You don't have to go through the, like sometimes it's like a 3-step process.
Yeah, no, I know. You can call directly and make an appointment. And I really want to kind of target the postpartum audience because, like I said, a lot of them suffer in silence.
Yeah.
And I think Urogyn, is for the 80-year-old woman who's in like large pads, but it's really not. We need to reach younger patients.
Interesting. And I too want to, to focus too on the suffering part, because I think that moms in general just kind of like we're the last ones to go to the dentist, the last ones to make appointments for a million different things because it's just always a juggling act. But if you really are like, it's probably a daily thing where they're,
Totally.
and sometimes in pain as well.
Yes, sometimes in pain. I would say pain is not always the presenting symptom, but
is it like more pressure than pain?
It's more pressure, feeling of my bladder is never emptying, like that type of feeling.
Okay.
And also going back to like the busy mom lifestyle, a lot of us don't take care of our diets as well as we should.
Okay.
So I always talk about, this is my favorite drink, but like a Diet Coke with lemon, for example, has like all the bladder irritants you can imagine. Even though I'm a Diet Cokeaholic, but it has, artificial sweetener, caffeine, the lemon, so anything citrusy. Some people don't realize that citrus in the form of tomatoes and even salad dressings like vinaigrette can irritate the bladder. But the one that people don't always catch is actually bubbles in their drinks, or the CO2 gets processed through the body as an acid. So anything acidic can kind of irritate the lining of the bladder and make you feel like you have to go more frequently or urgently. So, you're doing the carpool, and if you have, sort of your seltzer in the water or seltzer in the car, or
is caffeine too?
Yeah, because caffeine's a diuretic.
Right.
Yeah, it just makes you want to go more frequently. And I know we all love our large, emotional support water bottles, but we don't have to drink so much water.
No, we talk about that because it's so funny. It's like, I don't know. Yes, it's good to stay hydrated.
Yeah.
I, in particular, I have vasovagal syncope and stuff.
Yes.
So I need to, I know how I am. It's like salt constantly and water constantly, basically, and I have AFib too. So it gets very exacerbated from that. I'm a mess.
You can still have vaginal estrogen, though. Don't let anyone tell you otherwise.
Oh, really? Okay.
With AFib. Yep. Mm-hmm.
So that's, something that I have my own personal health. I think I need to be more hydrated.
Yes.
But but when we joke as kids, we didn't drink water.
No.
We drank milk at dinner.
Yeah.
I drank water if I was really thirsty, or if from sports and stuff. Or mostly we had Gatorade.
Right.
But no one really drank. No one carried drinks around.
Right. No, exactly. I actually remember shopping with my grandmother, and that was the Great Depression era. So we would carry a Poland Spring bottled with water, and she'd be like, "Don't carry that around. It's the status symbol, blah, blah, blah." But now, we do have these water bottles that are just kind of an accessory at this point. It's interesting.
My daughter last night, this is funny, the commercial came on for the Stanley Cup for hockey.
Yeah.
And she literally said, "They're having an event for Stanley Cups?"
Oh, my gosh. Yeah, here we are.
I was like, oh, my God, no.
Yeah.
So
that's so funny.
That's where we are.
Yeah, that's hysterical. Oh, gosh.
So, yes, it's the obsession. But I guess they're hydrated. It could be worse,
It could be worse.
Yeah, drinking lots of water. But I don't know. If I'm that much more glowy or whatever because you're so hydrated.
I know.
And how much is too much? Because you can also be overcharged. It's a whole time.
Right. It's a whole nother talk. I tell my patients who have sensitive bladders, definitely a glass of water with each meal, and then drinking to thirst in between. So I typically say 6 cups is probably okay. So 3, and that includes the morning coffee, so around getting to 8. I think everyone gets fixated on 8. 6 is probably just fine unless you have other needs. To your point, you probably need to drink more than the average person.
Right. And also whatever you ate, sometimes you feel dehydrated, or if you're exercise a lot, and there's different factors. But yeah, I'd say I agree. I think I don't even think I do eat. I think I just try to do. Yeah. I don't know. Whenever throughout the day, I'm always okay, more water.
Yes, exactly.
Or whatever. So, so I want to also talk about an exciting new webinar and meetup series that we are launching with Hackensack Meridian Health and Hackensack Meridian Children's Health to really meet and connect with moms to talk about a lot of these different topics facing for moms for children's health. And we are kicking it off with our it's a parent guardian talk series, Motherhood, Mind and Body, which is May 30th from 7 to 8 o'clock. This one is virtual, so you can register register online and sit and listen in. So this is in honor of Women's Health Month. We are spotlighting Mom's Health featuring Dr. Stephanie Sansone, urogynecologist, and Dr. Regina Kaplan, OBGYN, and also Dr. Nina Ross, who I know you mentioned is incredible. It's a postpartum mental health specialist, so we look at moms holistically to share guidance as they navigate their ever-changing bodies with the reminder to take care of themselves. So we're going to be discussing postpartum and beyond, reviewing how hormones change in postpartum and years to come is really important, and also tips to help with coping with the major life changes and detecting when something is wrong. So I'm sure that'll be a great discussion.
Yeah.
We have an hour. I don't know how you're going to pack all that in.
I know, exactly. Between three of us, it'll be great.
That's going to be great. So we're going to link it in the notes here, but you can also check both Hackensack Meridian website for more information on how to register, but we're going to put it on our calendar, and we're also going to be putting it on our socials. So so look for that. It's a little bit of ways away, so we'll have some time to remind everyone, but I'm excited for this.
Yes.
I think it's good. We're going to be doing this, and then also some in-person meetups too, so walking with different doctors and chatting about different topics, and also just connecting with different moms, right?
Totally.
So that'll be good because I think moms are always looking for ways to like meet and
Definitely.
and not be so isolated, because it can be very lonely being a new mom. I remember those days. So
yes.
How can everyone find you and make an appointment to see you?
Yes, so I primarily see patients at the Hackensack Meridian Health Eatontown Health and Wellness Center.
Oh, yeah.
So that's it was where like the old DSW was.
Yep.
So that's where my office is, and then I operate primarily at Jersey Shore as well as Riverview Medical Center.
Oh, perfect.
Yes.
Okay. And we'll link everything there, so if you need to make an appointment, and you can find Dr. Sansone.
Exactly.
So, thank you so much for coming on today. This is so helpful. I learned a lot, as usual.
I appreciate it. Thank you so much. This is great.
Yeah, I'm getting like maybe at the end of this series, they'll give me like a little like mini doctorate, like a little.
Oh, I definitely agree, for sure. I agree.
Like, Kate knows enough.
Definitely.
About a lot of different topics.
Exactly.
Well, thanks for listening. Coming up this spring, don't miss the Mom with Mom Summit. That is Thursday, April 11th at Bell Works. It's a day curated for support to working moms in our community. We're really excited about it. So check themomwithmoms.com for more information and how to get tickets. And then also soon after that, about a month later, we have our Spring Festival also at Bell Works. It's a great community day. Come out. We have over 100 vendors, an indoor kids zone. We also have an outdoor touch-a-truck zone. Local food. Hackensack will be there, part of the Touch-a-Truck. They set up an ambulance with, it's actually really cute. They do X-ray for teddy bear X-ray.
That's so
thing.
cute.
So, and it just kind of,
I love it.
It's really cute, and it kind of makes it a bit more approachable with kids, that they'll remember seeing the teddy bears going through the X-ray. So God forbid if they ever have to go through that themselves. It's just gives them a little bit less anxiety around it.
So cute.
I love that. And then you'll also have 4 tables inside, and they have all kinds of fun things planned for the kids.
Awesome.
So look for that. It's free to attend. So come out a week before Mother's Day. You can come and shop local Mother's Day gifts. There's crafts that we're doing, so you can make something for mom that day. So
cute.
So we're excited for that and more. So you can register on our site for that as well. And as always, look for local events, resources, and things to do throughout the community. We have our Spring Fun Guide running right now. We also just put out a day trip guide. So if you're looking for things to do this weekend or over spring break, you can check that out. So as always, check themomwithmoms.com for everything and more. And we'll see you soon.